The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Olecranon Bursitis by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In this video, we're going to discuss Olecranon bursitis, how to diagnose it, and how to treat it. We'll give you some simple home treatment remedies, as well as some simple home diagnostic tools to help you confirm the diagnosis of Olecranon bursitis. So first of all, what is Olecranon bursitis? This is a relatively straightforward diagnosis that you certainly can do at home on your own. Olecranon bursitis is swelling at the tip of the elbow. It oftentimes will look like a golf ball or sometimes even a tennis ball or anywhere in between. Sometimes this can come about traumatically if you really bang or hit the elbow against a hard surface, or oftentimes I'll see this in patients who have to work down on their elbows, such as mechanics or carpenters or plumbers. Sometimes this comes about insidiously, meaning no history of trauma or any injury at all. This is something that just occurs really for no good reason. A bursa is a thin sac, which is a potential space that surrounds most of our joints, and that helps the joints glide, and it helps the skin overlying the joints glide. If that bursa sac becomes inflamed, then that potential space fills full of fluid, and it becomes a sac, which is bursitis. So this is something that typically will swell up relatively quickly, whether there was a trauma or whether there was no trauma at all. Occasionally this can become infected. Most of the time this is what's called a sterile Olecranon bursitis. So this is just a non-infected swelling at the tip of the elbow. It's not overtly painful for most patients. It is occasionally if you rest your elbow on a hard surface. More than anything, it's cosmetically displeasing, and patients just don't quite know what it is.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.